Hello, my name is JMoore, and the title of my thesis is Exploring the Relationship Between Standardized and Semi-Standardized Versions of the Peak Relational Training System Assessments for Children with Autism. Alrighty, so first we'll take a look at my intro and discuss some things in there. Then we'll go on to my methods. Then we'll go into the results of my study, and we'll end it off with a conclusion. So, for the intro, we know that a number of individuals that have been diagnosed with a developmental disability continues to grow every year, and that one disability that has become highly prevalent is autism spectrum disorder, increasing nearly 120% since the year 2000. And so, as the number of individuals that are being diagnosed with autism continues to grow, the number of treatments that are out there to help individuals with autism continues to grow as well. And some therapies, such as holding therapy or the miracle mineral solutions, um, they've all seemed to grow a lot in popularity, but they all lack the research that's needed that considers them to be evidence based and to be effective. So that's kind of where applied behavior analysis comes in, also known as ABA. ABA is one of the most commonly used behavioral treatments for individuals with ASD. Um, ABA uses techniques that are based upon scientific principles of behavior and that have been shown to address certain behavior changes and have shown to be effective. So, for just a little bit about autism, so currently there's no known cause for autism spectrum disorder. Um, Scientists and doctors have worked extremely hard um, to be able to provide parents with a cause for autism, but currently there is not one. Um, Autism is very individualized. So individuals with autism often um, have deficits in certain areas. And so with it being individualized, someone that's diagnosed with autism may have deficits in some areas, while another individual that's diagnosed with autism may not have those same deficits. And some deficits that individuals with autism have as verbal and nonverbal social communication skills. They also have deficits in language and cognitive skills, and they also exhibit some emotional and as well as behavioral challenges, um, which can be difficult because autism not only affects the individuals that's diagnosed, but it also affects their families. Um, Parents often experience a lot of stress when it comes to autism just from when they get that first diagnosis all the way up until trying to find the best effective treatment for their child. Um, so Skinner has done a lot with verbal behavior, and just his definitions and his descriptions of verbal behavior that include mands, tacts, introverbals, echoics, etc. They've all been used for the development of different assessments that are out there that help professionals figure out an individual where an individual skill level is, um, whether that be with whether they have autism or other developmental disabilities. Um, so there's semi-standardized assessments, and there are also standardized assessments. Um, so just some things about some semi-standardized assessments. Most of the time, they may include an instruction manual, and they may also give you some guidelines on how to complete the assessment, but they're not really standard. Um, and where standardized assessments might give you more of stricter guidelines on how the assessment needs to be implemented and how it needs to be followed exactly. And they also provide like specific requirements as far as the responses that need to be given from the individual that the assessment is being conducted on. So just some examples of some semi-standardized and standardized assessments are the Verbal Behavior Milestones and Placement Program, which is also known as the VB-MAP, the Assessment of Basic Language and Learning Skills, which is known as the ABLES, and Promoting the Emergence of Advanced Knowledge, which is known as PEAK. So for my methods, I used 24 participants that were all receiving some sort of ABA therapy from a clinic in the Midwest. Um, so each participant was administered the previous version of the PEAK pre-assessment, which is a more semi-standardized assessment. And they were also administered the current version of the PEAK pre-assessment, which is a more standardized assessment. Um, there are two ways to administer the assessment. One being tabletop, which the implementer and the participant are sitting at a table and the assessment is being administered on the table. Or there's also the four corner administration method, which the implementer and the participant were on the floor, and where the child was in the corner, and the implementer is in front of the child with the administration booklets, conducting the assessment that way. Um, the floor corner administration method is used for individuals who may present more problem behaviors, or they just may not have it in their repertoire to be able to sit at a table for a certain amount of time. So these are the results of the uh, Pearson correlational analysis that was done for the both assessments. This graph right here is showing the total scores from both the previous assessment being along the bottom and the current assessment being along the vertical. And so as you can see, it shows a strong, significant correlation between the total scores for each individual. And then also on the side, I have the Pearson correlational analysis for each module, if for each module from the assessments as well, which they all show a very strong, significant correlation as well. And then these are just the individual graphs for each individual module. The DT being at the top left, the G being at the top right, the E being at the bottom left, the T receptive being at the bottom right, and the T expressive being on this page. So besides the Pearson correlation, there is also a item analysis that was conducted to examine if one of the assessments may have produced a higher or lower score over the other. And it did show that the previous assessment did produce higher scores over the current peak pre-assessment. And so this was just suggesting that even with the significant correlations, we we still need to do more research when it comes to the current peak pre-assessment, because we can't just assume that what was found in the previous literature about the previous peak assessment, it will still apply to the new version of the assessment. So for the conclusion, the discussion, the results indicate that there's a significant relationship between the previous peak pre-assessment and the current peak pre-assessment. So they're measuring the same thing, um, which is good. Um, and the current findings are important because this gives a chance for any professionals that may still be currently using whether if they're using the old or the current peak pre-assessments, they can see that they're significantly correlated, and that the current peak pre-assessment is a reliable tool to use for the moment. Um, I would say some limitations of this study was that some varying levels of experience when it came to the therapists that were administering the assessments. Um, just it may have influenced the way that some of the therapists handled problem behavior during a session if it did come up, or just how they administered the assessment as a whole. Um, I know that some individuals may have not had enough training as they would have liked when it comes to administering the assessment. So maybe they focused on administering the assessment a little bit too much, causing them to have some hiccups while administering the assessment. Another limitation that I would say is the small sample size, um, due to certain time constraints and also some unforeseen circumstances. Um, I was not able to get all of the participants that I wanted to get. Um, so that's kind of goes into future research. I think future research should be able um, to be able to use a wide variety of a wide range of individuals, whether that be a difference in age, disability, and also like level of severity of their disability. Um, I also think that future research could seek um, to analyze a difference between the implementation errors that may come from both of these assessments. And it can also look at the total time it takes to set up for each assessment and also to implement each assessment. And I know that I talked a little bit about standardized versus semi-standardized assessments. And so I think future research could touch on that a little bit more and go a little bit more in depth as far as semi-standardized versus standardized assessments. Alrighty, thank you for listening. I hope you enjoyed, and have a wonderful rest of your day.